National studies are showing Latinos from a variety of backgrounds are among the most skeptical towards the COVID-19 vaccine, even though they are among the groups most likely to be hospitalized or actually die from the disease. Fox 6's Angelica Sanchez went right to the experts to get answers.
Unfortunately, there is a lot of misinformation on social media.
Dr. Nicole Fortuna with 16th Street Community Health Center has been answering plenty of vaccine questions from patients.
You want to make sure you go to a trusted source.
It's no secret there is a limited amount of vaccine available, but in Milwaukee County, data shows the majority of COVID-19 vaccinations so far have gone to white residents, a fact that concerns city leaders like Mayor Tom Barrett.
This is something that demands that we have equity.
Milwaukee County health officials hope to see a shift in the data in the coming weeks as the vaccine opens up to more people. They say the data looks like this for now because the majority of frontline workers to receive the vaccine so far are white. But there's another concern that walks hand in hand with vaccine distribution: uncertainty.
We have to find people who can engender trust to say this is safe for you.
National studies are showing Latinos from a variety of backgrounds are among the most skeptical towards the COVID-19 vaccine, even though they are among the groups most likely to be hospitalized or die from the disease. One Milwaukee man tells us what he is hearing from the community.
I think the majority of Hispanics don't want to. They're afraid. They don't want to get it until others do, and they'd rather wait until the end.
He says it is hard to pinpoint where the hesitation is coming from. Something that gives him comfort is seeing first responders get the vaccine.
I think it's really good they're giving it to the most important people. If it wasn't safe, they wouldn't have given it to doctors, police, and firefighters.
Research from the Centers for Disease Control available through late last month showed Latinos were 4 times more likely than whites to be hospitalized with COVID-19 and nearly 3 times more likely to die, numbers higher than any other race or ethnicity at the time. On February 12th, the CDC updated their numbers, showing improvements in both of these categories.
Now is the best time to get the vaccine.
Debunking one of the most common misconceptions, Dr. Fortuna says the vaccine does not give you a dose of the coronavirus.
They use something called mRNA. This is just a little message to your body to start fighting against the virus.
She says the vaccine was able to roll out faster than most because the science behind it has been studied for years. She says if you feel achy or feverish after a dose, it is your body building immunity. She advises those with a history of allergies or those who are pregnant or breastfeeding to have a conversation with their doctor before getting their shot.
You know, it's important to get the vaccine now because we're starting to see changes in the virus.
But she strongly advises people not to skip their turn to get the vaccine.
Those mutations have made it easier for the virus to spread more rapidly and get more people sick.
If you have doubts or fear over the vaccine, doctors urge you to look for facts over misconceptions or opinions.
Reach out to your medical provider, to your doctor.
Recently, President Joe Biden signed an executive order to ensure an equitable pandemic response and recovery plan. Among the goals listed is to make sure vaccine distribution remains as accessible and equitable as possible. Reporting in Milwaukee, Angelica Sanchez, Fox 6 News.
Great information there, and you can find this report entirely in Spanish on our website. Just go to fox6now.com.